Good morning to you all. How are you?
Good morning.
Hi, Rebecca.
All right, YouTube starting up. 1 second. Here we go.
Good morning. Good morning, San Ramon. Welcome to the third edition of the Mayor's Breakfast. We are, again, privileged to have a number of returning guests and a couple of new guests. Quickly, I'll introduce who will be on our program today. Our city manager, Joe Gorton, and of course, they get kind of wave when they're introduced. We have County Supervisor Candace Andersen. We have our Assemblywoman, Rebecca Bauer-Kahan, and she has joined us. She's new this week.
Good morning.
Assemblywoman, good morning. Thank you. Rick Shumway, who is the CEO of Stanford ValleyCare here in the Tri-Valley area. Rick has joined us, and returning is Dr. Joseph. Dr. Patrick Joseph was here last week, answered some great questions. He got great feedback, and we're looking forward to more stuff from the doctor later on. To kick it off, I wanted to, again, give you a quick summary of what's been going on this week, along with our city manager. Quarterbacking this, by the way, for us is Steve Spadowski, and Steve is our deputy city attorney and city manager. And he is, again, will be taking your questions. You can address the questions at info@sanramon.ca.gov. He's gotten already upwards of 30 questions. He's trying to organize those so at the end he can ask those questions to the guests. So Steve, thank you for quarterbacking both the broadcast and our questions. Joe and I are going to take a few minutes here to update you on what's going on in the city, and perhaps the most prominent thing we did is had a budget workshop last Tuesday, and where we discussed and talked about the impact of the COVID crisis on our city finances. One of the comments I had made to staff earlier was that when you live by the sword, you die by the sword, and we are not a sales tax rich city. And we've been working very hard to get and increase our retail base. But the good news is we are not going to be taking as big a hit as other cities because our sales tax base is not as large as the percentage of other cities. So we still are going to suffer both this current fiscal year, a drop in revenues, and we're having to make some adjustments. And we're looking also of a hit next year's budget, but because we have ample reserves and I think some pretty smart budgeting by our city manager and our financial department, that we'll probably not see significant reductions in service, but it is going to be a challenging time. And Joe can give more specificity as to the fiscal impacts, but I think most residents may not recognize a change in services, but it's going to have an influence, isn't it, Joe?
Yes, it is. Thanks, Mr. Mayor. We, without really getting into the details, because we're just now trying to evaluate the impacts, we do know that it's going to be at least probably around $2 million impact to this year's budget, meaning this fiscal year prior to July. And then next year, the city, we've made several cuts in areas that we don't feel would harm any service delivery. And we're looking at potentially anywhere from $3 to $3.5 million in that area, 3.6 million, I think, for the budget that we're presenting to the council, and it will be their deliberation and consideration and decision on whether to continue to trim that down to which may affect some service delivery pieces, or to continue forward with that. We do have a strong reserve. We can do that. And so those decisions will be made in the coming months. There'll be another budget workshop sometime early next month. And anybody that would like to see the workshop that just occurred, you can go to the city's website. We have a feed there, a YouTube feed, in which you can watch that in its entirety.
We did that budget workshop using Zoom. The budget workshop will have also next month will also be on Zoom, so people can not participate, they can watch and there'll also be a chance for public comment. So, Steve, we talked briefly about highlighting the city's COVID-19 website. Did you want to go ahead and share that? And there were some things you wanted to let the folks know about.
Sure. Let me click on, hang on one second here. All right, so I'm screen sharing the city's webpage. Can you see it here?
We see shop online, the farmer's market.
Okay, hang on one second here. There we go. So you should see the city's homepage at this point. Is that coming up, Mayor?
Yep, it sure is.
All right. So on the city's homepage, we have our link to our COVID-19 update site. And as the mayor mentioned, you can submit questions at any time, 7 days a week, to info@sanramon.ca.gov. If we don't get to your questions during the mayor's breakfast, we will be responding to you throughout the week. But if you go to the city's main website at sanramon.ca.gov, you can click on the COVID-19 update page, and it will bring you to our all of our links. So any information that the city comes across, we make sure that we link to this page. It's your one-stop shop for links to everything for recreation, local takeout. We do have Senator Glazer and Assemblymember Bauer-Kahan's sites linked as well. This week, I want to highlight, we included the farmers market link. The San Ramon Farmers Market now has online shopping. So you can order, you can see a lot of staples now through the farmers market. You order online and they have contactless pickup now for the groceries. So you can drive up and they load it up for you and you're on your way. So that's, again, go to the city's website. We have all the information posted there, anything that we come across.
Steve, thank you. That's really great. I know one of the things folks talk about is getting fresh bread and other things that are sometimes hard. And when you say they can call in, and it's at the city center, and there will be designated areas where they can drive up and have it put into their trunk, and then they can take off, correct?
Yep, you can order online. So you place your order, you select, it's like a regular online shop, and they'll have it ready for you when you get there.
Steve, thank you for sharing that. One of our returning guests is our county supervisor, Candace Andersen. She has been wonderful and every week giving us an update. As you know, the county is our front line disseminator of information, both especially from their health department. Candace, what can you tell us about this week and what's happening next week, perhaps?
Okay, yeah, a lot going on. So today we're up to 631 cases in the county, and unfortunately that does include 16 deaths. And as I mentioned last week, we are now breaking it down by city. So in San Ramon, there are 27 cases, which comes out to about 36 per 100,000. And by comparison, Danville's at 22, which comes out to 51 per 100,000. So you're doing a little bit better than Danville right now. Alamo is pretty high. It's 17 cases, but that comes out to 115 per 100,000. In the county right now, Orinda is still the highest at 36 cases, or 199 per 100,000. Of course, we had the Orinda Care Center there where we had 29 positive residents, 24 positive staff, 4 people who passed away. And the state oversees nursing homes and skilled nursing facilities like this. They did come in last week to assist with staffing and other oversight. Other congregate care place we're seeing a problem is the Carlton Senior Living in Pleasant Hill. There are about 145 residents who live in that facility. 35 of those residents have tested positive, and that's included 3 deaths there, and 23 of their staff have been positive. And we've got great support from the medical providers of those people who live there, coming in to provide infection control support, PPE supplies, to ensure that the rest of the residents and staff are protected. And we are now, through the County Health Services, conducting investigations almost all of our congregate living facilities in the county to ensure that they're protected and we won't see the same incidents that we have, that we'll be able to detect just a little bit sooner if we have cases. So big question in everyone's mind, we've got an order in place until May 3rd. And in my briefing this morning, we talked to Dr. Farnatano, and it looks like at least 7 days before the expiration of that order, all of our 7 Bay Area counties who are currently participating are going to come up with a new order. We'll have plenty of time to sort of digest it, to look at it. What it looks like, we don't know yet. And the key signal is going to be our hospitalization number. And so if we have hospital ICU numbers remain flat, we might allow for some opening up. Again, very limited, masked, social distancing. No one wants to just flip that switch on, but sort of, what we're calling turn the dimmer on, so that we avoid what we've seen in Singapore and other places where you see a big resurgence. And so we're going to see probably multiple small incremental steps. And if we see any surge in hospitalizations, we're going to immediately need to put in more orders. And now on our dashboard, you can track hospitalization. And so right now we have 37 hospitalized confirmed cases. We have sufficient capacity in ICU beds. Right now we're showing how many ICU beds are occupied on the county's dashboard. And that doesn't mean with COVID patients, all occupied ICU beds. So you can see the capacity. And so currently 106 of the 182 ICU beds in the county are being occupied for whatever reason. Right now, 60 of the 289 ventilators that we have are being utilized for whatever reason as well. Other things that are going to be new this week, later today, you will hear our health officer offer up a new order. Now, the orders are what he is legally entitled to do. We don't approve it as the Board of Supervisors, and this order is going to now mandate that you wear a mask anytime you are out in public where you're going to interact with people. We've been recommending it for the last couple of weeks, and now it is going to be a requirement, and that if employees are working in a setting where they're around other people, they must also wear a mask. There should be a press conference around noon, and we will see that order coming out, not just from Contra Costa, but for around the Bay as well. We're doing a lot for our homeless right now. We are sending, at request of certain cities, sanitation centers where we have encampments. We're encouraging cities and police not to disrupt the encampments. They're functioning homes, so to speak. They're working together, and we want to provide added levels of sanitation. We have our core teams going in to provide not only sanitation recommendations, but also to be able to assess for their medical conditions. And if someone appears to be becoming ill, we can take more extreme measures. We have now shut down, in essence, all of our homeless shelters. We are not taking in any additional people, and we have housed them in hotels throughout Contra Costa County. They are being housed in blocks of wings of hotels, or an entire hotels have been rented. And then we have our providers like Shelter Inc., who are there providing the supportive services to those individuals and families who have been relocated into those individual rooms. We have 3 meals a day being brought in through some of our providers, and we've got some great partners that are doing that as well. The Craneway Pavilion, which is our 250-bed alternative care site, expected to be up, ready to go next week on April 20th, and that will be for treating low-level COVID patients who don't have a place where they can safely, because of their family situation, get through the illness at home, but they don't need the high level of hospitalization. Board of Supervisors, this past Tuesday, we did approve the creation, and it's coming back to us on Tuesday for an actual ordinance, a county-wide moratorium on most evictions. Now, as you're probably aware, the state, through the governor, already has pretty much banned evictions taking place. The courts are not allowing them. This gives a buffer, and it will provide some relief. It's not any forgiveness of rent. Rent will consistently be owed our tenants, and something I continue to advocate. It's finding the right balance, because our landlords are also suffering. It's not just the tenants, but this will give people up to 120 days after the moratorium is lifted to pay back their rent and not fear the risk of being evicted. The goal, particularly with commercial businesses, is that when, again, we start lifting restrictions, they're going to be able to open their stores, bring back their employees, sell off their inventory, and not just face an eviction notice. And so we're trying to work through those issues. We're also expanding some of the moratorium provisions just to make it a little bit easier on families and on individuals. We don't want more people being left homeless in this crisis. And quick update on the sheriff, because I mentioned it last week, we are still considerably not accepting bookings in our jail. And it's a challenge. I mean, many of us saw on TV last week what happened out in East County, where someone showed up at someone's door with a machete, chopped off their Ring doorbell, and they tried to book them, but hey, it was just a property crime. It wasn't, face-to-face with an individual. Currently, our jail capacity, which I've mentioned before, is about 2,000 inmates, is at 722 system-wide. We're about 36% of capacity. And we have an additional about 466 out of custody on an alternative custody program. And from a good example of what bookings looked like. Before we had the stay-at-home order, February 16th to March 15th, about a 30-day period, we had about 1,172 bookings, about 60 per day. March 16th through April 13th, we had 10 bookings per day. So an 84% drop. And there's still a big push for many that they want to see everyone out of jail. And so we did have the sheriff come to our Board of Supervisors meeting this week. Who's still in jail? 164 defendants who are facing murder charges, 98 facing child molestation charges, 22 charged with rape, 18 charged with kidnapping, 108 charged with robbery, 101 with burglary, 186 charged with assault with a deadly weapon. And the sheriff's not going to release those folks. And so it's finding that balance. It's how do we keep the community safe while at the same time avoiding any issue within our jails. And as I mentioned last time, we are doing very careful procedures. Is when someone is booked, they are isolated for 14 days in case they've been exposed to the virus. We have doctors who come in regularly. We're checking temperatures. And the sheriff mentioned that there was actually a fight that broke out in the jail last week because some inmates were mad when another inmate wasn't wearing a mask and sort of violating some of these orders. So those are some of the new things that have happened since I talked to you last week. And later on, I'm happy to have any questions. So thanks so much, Bill.
Candace, that was a lot of information. Thank you very much. That was wonderful. Next, Assemblywoman Rebecca Bauer-Kahan has been your second year now in office. And it's been a rather interesting few months for you up there in Sacramento. Share with us some updates and things you think would be useful for our residents here in San Ramon.
Awesome. Well, first I want to thank you, Mayor Clarkson, for doing this and for giving the residents of San Ramon a real quality way to get good local information. I think that is so critical right now. So I appreciate you continuing this. I also want to just give a shout out to my partner at the county, Supervisor Andersen. I think a lot is made of California leading the way in sheltering in place and saving lives, but I don't want us to forget that it was the Bay Area that did it first, and that Contra Costa was one of the first counties to partner in that shelter in place order to say a week before the state, it's time. We need to stay at home. We need to keep people safe. And as you heard from the supervisor, we have resources to take care of everyone who needs it. And that is very much because of that order and because of our residents doing their part in actually complying and staying at home. And we see that it's working. We see that we have what we need as a result of everyone doing their part. And so I want to thank the residents for listening, for complying, for making sure that we are taking care of each other. And we have just seen residents in this county and in San Ramon come together in incredible ways to take care of each other. So thank you to all of you. And thank you to the city. I mean, we've seen you do some incredible things to take care of our seniors and to provide access to essential needs. And it is absolutely every level of government working together that has gotten our community to where it is. So thank you all. So a little update on what's happening in the state. Before we are currently on recess so that we can all be home supporting our communities. Before we went on recess, we appropriated $1.1 billion, which we have been seeing the governor spending on response to the COVID crisis. So that is the money that is being spent to surge our hospital capacity by ventilators, PPE, those hotel rooms you heard just a few minutes ago. Some of the money is going to help the county rent those. So a lot of resources heading towards our counties to respond to this and keep our communities safe. And we are lucky to live in a county that is doing a phenomenal job in balancing everybody's safety. And I think that we see that every day. So we wanted to make sure we were supporting that. One of the things I really want to talk about is unemployment, EDD. It's something a lot of our community is facing and needs and have never needed before. I know that it didn't go smoothly at the beginning. We went from record low unemployment numbers to a need we never could have anticipated as quickly. And as a result, we had a phone service that only was open in the morning because that's all we needed. We were at record low unemployment, and now people need significantly more resources. And the state has worked really hard to surge the capacity to serve people. And the good news is the state is succeeding. So before this crisis, it took 3 weeks from filing to receiving your unemployment check. The state has been able to maintain that timeline, which is pretty phenomenal given the massive increase in need. And so you should, from the day you process to getting your check, should be about 3 weeks. And if you have questions or needs, please reach out to my office. There has been a little bit of a confusion about the call center. So I want to be really clear that the governor has extended phone hours. As of Monday, it will be 8 a.m. to 8 p.m., 7 days a week. So if you need help from EDD, you can call anytime from 8 to 8 and you will get that answered. We've been able to do that because we've taken 1,400 state employees from other agencies and redeployed them to EDD, which is phenomenal because by using current state employees, it didn't increase our state budget, but it gave us the ability to really meet California's needs right now. So please use those resources. The other thing is that the federal government created a program called the Pandemic Unemployment Assistance Program. Now that program provides unemployment for folks who previously weren't eligible. So those are self-employed individuals, independent contractors who traditionally could not get unemployment. You are now eligible. Now, because that was coming down from the federal government, we had to wait for guidance. That is now here. So that program is being put into place and that application will go live on EDD's website on the 28th. So if you are waiting for that unemployment and you need it, come online on the 28th and fill out that application. The good news is, although you have to wait to fill out the application, EDD has assured us you will get that check within 48 hours. So even though it's a couple weeks, you will still fall within that 3-week time frame from right now, and it will come before your May bills are hopefully due. So again, if you're eligible as an independent contractor, April 28th, go online and fill out that application. And you should also be getting the additional $600, and that is retroactive in your check the federal government gave to you. So that's a little bit of information about unemployment insurance if you need it. And by the way, you're eligible if you're unemployed or underemployed. So if your hours have been cut, you can apply to make up that missing gap. We want people, you heard a lot about Supervisor Andersen talking about eviction, and I want to really give credit to the county for taking that important step. We want you to be taken care of during this crisis. We want you to be able to keep your home, to feed your family, and unemployment is an important way to do that. Another thing that people are really focused on, and we're getting a lot of calls about, is tax deadlines. So importantly, and I want everyone to know that both the federal government and the state government have moved our tax deadline to July 15th. So if you're worried about paying those taxes coming up, you've got some relief in a couple months until those are due. There was a property tax deadline that was not moved, but if you were unable to pay it, it's really important to know that the county assessor's office will work with you so you will not incur fines. So if you're unable to pay, please reach out to the county assessor's office and we can connect you and give you more information about that. But these are not the things we want you worried about if you're unemployed and struggling to pay your bills. The government is here to support you. So again, a little bit of relief on that front. Small businesses. I have to say that I think we are seeing entrepreneurship at its most remarkable. I mean, we're seeing small businesses pivot in incredible ways. Restaurants go to markets, and restaurants that used to serve very traditional meals, serving family meals. I mean, the farmer's market in San Ramon doing a website with drive-up service. All of this is really our small businesses at their finest. So keep supporting them if you can. It's really important, but we're here to support as well. I know the news came out yesterday that those SBA loans that many people were hoping for have all been that the money has been spent. Now, I've heard from Congressman Swalwell's office that it is not clear if you put in an application, if you will not get those funds. They have not given guidance whether that money has been spent, meaning it has been given out, or whether they have just exceeded the application amount. So stay tuned, don't panic yet. And I know Congressman Swalwell's office is here to answer that question, but I wanted to provide that because that just came out yesterday. I know it made a lot of small businesses nervous. And the state government has committed another $50 million to businesses that won't be supported through the federal government. And again, I know our congressman is working hard to get additional SBA loans for our small businesses so we can keep you alive through this time. And those are really great loans. But one thing I want to make sure I point out is that there are 2 different loan programs. And if they get re-upped and if you become eligible, you can apply for both. And the way you use them is a little complicated, but you want to maximize it. So reach out to the congressman's office, reach out to our office, reach out to the SBDC so you can maximize the usage of those loans, because I am optimistic that more will come. Finally, the DMV, something people think about a lot, even right now. So many of you might have licenses that are expiring, and you don't want to go to the DMV right now because you're staying away from grocery stores and other places. That's the right choice. We do not want you going to wait in line at the DMV if you need DMV services. So as a result of that, we are guaranteeing that the DMV has announced that for 120 days, there will be no enforcement of expired licenses. So you do not need to worry about that. You stay where you are, shelter in place. If the shelter in place orders were to extend, we would extend that timeline. So do not worry about an expired license right now. We will make sure that is taken care of after the shelter in place order. Your safety is our #1 priority. So, and I just want to talk a little bit about communicating with state agencies. We are on calls constantly with the Office of Emergency Services, with the governor's office, and with other agencies here to support the county and all of you. So the San Ramon website has a link to my website, and there's a lot of information there where you can get virtual town halls on these small business loans, on where to get help if you're food insecure, and other really important issues. So please go there for more information. The state has a website, covid19.ca.gov, that's really helpful. And these websites are really critical. I know many of you heard about the health corps that the government was starting, and tens of thousands of healthcare workers signed up. So we're using the web in really incredible ways to get us the resources that we need. AARP has also launched a program to check in with elderly neighbors. If you want to be involved in that, that's a really exciting program. And I think you have one locally in San Ramon too. So that's a little bit about what's going on. We're here to support you. People are often surprised when we answer our phones. We're an essential government function. We are here to answer your phones. People are remote, so that we're not violating any of our shelter-in-place orders, but we are here to serve you. So please, please call if you need any assistance. And if we're not the right agency, we can get you to the person who can help you. So just remember, all of us are here to help you no matter what it is you're suffering with. Thank you for sheltering in place. Thank you for doing your part. And we hope that all of you get through this safely. And one question that I'll finish with is what Supervisor Andersen was talking about, and the question we get a lot, which is, when is this all going to be over? When are we going to get to go out and re-enter restaurants and do all the fun things that we want to do? When are my kids going to go back to school? It's a question I ask a lot. So the governor announced that, you know, there were 6 factors that the state will be looking at to decide when we lift the state order, and that will be a lot of what Supervisor Andersen talked about. So the ability to monitor and protect our communities through tracking and tracing. So not getting to a point where it's too much, so we can't do that work. The ability to prevent infection for those who are most at risk. The ability of the hospital system to handle the surges, one of the things we've been most concerned about. The ability to develop therapeutics to meet the demand. The abilities for our businesses, our schools to practice proper social distancing as we continue to need it, and the ability to determine when to reinstitute these measures, as Supervisor Andersen talked about, if we start to get to a place where it's not safe, making sure that we dial it back. But we are all focused on reopening our economy, on allowing your life to go back to normal. But first and foremost, we want you to be safe. And so balancing that is really critical, but we understand you want to get back out there. So thank you all. Thank you, Mayor, for having me. And I'm happy to stay and answer questions as well.
Assemblywoman, wonderful summary, good information. Thank you so much. I'd like to introduce Rick Shumway. Rick's here for the first time. He is the CEO of Stanford Health Care here in the Valley. And we've been talking a lot about hospitals and their ability to care for those who are sick. And so from the front lines, Rick, tell us what's going on.
Yeah, I appreciate that, Bill. Thank you for having me. We first and foremost, I have to say we're so grateful for the support that we've received from our communities, and in the end, we are so honored to be able to serve as one of the regional health sites and centers to take care of people at this point in time. So thank you for your support. It means a lot. It means a lot to the people that are actually doing this work on a day-to-day basis. So what I wanted to do today is just hit a couple of key buckets that I think are of interest at this point in time to the general public. And the first thing is, and you've heard it both from the supervisor and the assembly member around how are we doing from a preparedness standpoint on the hospital front lines? Can we take care of these patients? Can we take care of them in surges, et cetera, et cetera? And what I'm very proud of is the work that's been done at our health system to ensure that we have put our region in the very best possible position to withstand a possible surge. We have spent, I know it's a matter of weeks, 6 to 8 to 12 weeks. It feels like 6 to 8 to 12 months of planning and execution. But I can tell you that this health system is exceptionally well prepared to take care of patients in a variety of surge scenarios. We have a formalized 5-phase surge plan that has to be reviewed by the OES to ensure that it is meeting the needs of the community and the potential surge projections. And I can tell you that this surge plan actually gives us the ability to surge up to well over 50% beyond our very, very top capacity. So we're actually in a really strong position to be able to withstand some of the surge activity that has been projected over many weeks at this point in time. What that means is hospitals have to be able to care for patients in novel care settings, but also to do so in the most safe and effective way possible. So as an example, one thing that a COVID-19 patient would ideally have access to is an isolation, negative airflow capable room. Where we can manage the HVAC and manage the airflow within a room so that that air is not going somewhere that we don't want it to go. And at our health system, 6 weeks ago, we had 7 of these isolation negative airflow capable rooms that also had ICU capability. We have gone to 56 of those rooms over the course of the last 3.5 weeks. That is a tremendous effort on the part of the many teams here, and we continue to look for additional opportunities to increase that capability. Another element that people ask about a lot is, how are your ventilators? And while that certainly is something that we are conscientiously monitoring and managing, I'm very glad to report that your local and regional health system certainly has good access to a large number of ventilators that, in the case of a surge, we would be able to deploy in a reasonable way. So we feel really good about that. Certainly PPE comes up regularly as a question. We have a very robust PPE task force that meets multiple times a day, that is sourcing PPE from all over planet Earth to make sure that we have what we need to take care of our people that are taking care of you. And the good news is again, we are in reasonable shape from a PPE perspective. We are accepting donations of non-homemade items at our Lifestyle RX building in Livermore. So if you have those donations that you would like to donate to Stanford ValleyCare, that is something that we would gratefully accept, but we are doing okay on PPE at this point in time. Another preparedness item that I think is unique to us and to this region is Stanford Health Care ValleyCare is one of only a handful of sites in the world where patients can participate in clinical trials for remdesivir, which is one of the drugs that is being utilized to fight COVID-19. There are 54 sites across the globe that are participating in this trial. 10 of those are in California, and 1 of those is in your community. So patients that come to Stanford Health Care ValleyCare have the possibility, based on eligibility criteria, to participate in literal frontline development of treatment for COVID-19. So that's a very, very important distinction and important for you to know as a community. We also have significant infection control protocols in place to ensure that whether you're coming here because you have suspected COVID-19 or you're having a heart attack or you have a GI issue or whatever it is, we want you to know that we have put this hospital in a place where it is as safe as it possibly can be for you to come and get healthcare. I will tell you, and this is my plea as somebody on the front lines, people are putting off essential healthcare, and we are seeing very negative effects of those decisions. Now, that's admirable related to managing the shelter-in-place request, but as you know, all of the shelter-in-place requests from the state and from the counties excluded most of healthcare operations in those shelter-in-place requests. And so what I don't want you to do is wait 2 days with chest pain and then come into the emergency room when you have a major problem. And I can tell you that that is happening. So please, please, please work with your primary care physicians and others come in when you need to come in. The hospital is a safe place to get that care at this point in time. Another bucket that people ask about regularly is testing. I'm very proud that Stanford Health Care has been on the very front lines of the development of novel and new ways to manage this issue. As many of you may know, Stanford actually developed one of the very first tests to identify a COVID infection. It was a very short turnaround time, 24 hours, when many of the other labs regionally were taking 7 to 10 days. So we've actually had access to that for our patients from the beginning. And then I'm also very excited that over the last 2 weeks, we have access here in our hospital, in our community, to the Cepheid testing, which is a 45-minute test, and the Abbott testing, which is the 10-minute test. So we are working very closely with our clinical partners to make sure we're using those tests in the right ways, but we have access to very rapid testing at Stanford Health Care, ValleyCare. Something else that has hit the news recently is this idea of serology testing. Can you detect antibodies in the blood to determine whether or not somebody has been exposed to COVID-19? Again, very proud to indicate that Stanford Health Care is one of the very first in the world to have developed a serology test to identify those antibodies, and it is available for all clinicians in the Stanford healthcare system. It is still early days in that particular element in terms of what are we going to do with that information. But it is certainly a cutting edge frontline implication that our organization is very much involved with. We do have drive-through testing sites, one here at the hospital and one at 5725 West Las Positas. And those are for individuals who have received an order for testing from their primary care physician. It doesn't matter who your insurer is or otherwise. If you have an order from your physician, you can drive through and be tested at those 2 testing sites. And we are certainly working very closely actually with our community partners to open a broader, more public-facing testing site in the coming week or 2. So we're excited about that. A note about modeling, as we've talked about, it appears that the curve is certainly starting to flatten. Many of the models say so, Stanford's, University of Washington's, government models and others. So I think that's good news. But we continue to keep our eye on the ball. Even though the surge has not come with the ferocity that we are seeing in some of the other parts of the country, we need to continue to be vigilant and follow the directives that our government leaders are helping us to navigate. So I think that's very important. What I will say about those modeling trends is, as we look at this at Stanford, we feel very confident with our hospital-based resources that are here ready to serve you in the communities. So based on what we project and see in the future, we think we're well positioned to take care of people. And again, I will just reiterate the last thing and then I'll be done, is again, we are prepared to take care of people right now. So please, again, seek, whether it's with us or any of the healthcare providers in the region, please seek care when you need it. We are all here to take care of all of those needs, not just COVID-19 related at this moment in time. So thank you for letting me be here, and I'll pause and take questions at the end.
Thank you. Rick, again, a wealth of information. Thank you very much. Dr. Joseph, welcome back again. You've heard comments from some really smart people already today, but I'd like to get your comments about those 2 subjects we talked about at the beginning of the program and any other insights you have about what's going on.
Well, thank you very much, Mr. Mayor, and thank you again for the invitation to return. Just to follow up with Mr. Shumway, I've had the opportunity to be in San Ramon Hospital many, many times. And yesterday I was invited to visit the Stanford ValleyCare. And I applaud you as well as every hospital administrator for the wonderful job you're doing in protecting the public and providing services. I was looking at the infection prevention and control services, and they are fantastic. So congratulations, sir.
Great feedback.
With the announcement yesterday of the phased in reopening of the country and what each governor will be doing, we are definitely going to see people returning to work to some degree. And it brings up a very important question. And that is, when I come back home from work, after facing with the public, do I need to do anything special? And I was so happy to hear that later today, that is going to also include wearing a mask when you're facing with public. So thank you for that announcement. That's fantastic. The quick answer is going to be, other than disposing of a disposable mask or washing a washable mask, nothing is necessary. Now, I know this has been extremely confusing because we're all hearing reports of virus being on cardboard, on paper, on cans, on many surfaces, and it does create a problem in understanding all of this. But the virus still has to get in your face. This is a respiratory infection, and if I have virus on my hands and do not touch my face, I will not get infected. Virus does not enter through the skin. It does not perforate through pores in the skin, even if there's infection around the fingernails. That will not cause this virus infection. So even if one touches something that is contaminated with virus, if you wash your hands or use hand sanitizer, you will not get infected. Now, the second principle is that most of these studies that are done that tell us that virus can live on cardboard or live on paper are not virus cultures, but they're the kind of tests that are being done in the crime scene investigation studies. They're just looking for a little piece of nucleic acid, and it doesn't tell us if it's infectious virus or a decaying dead virus that has been on there for a long time. And that gives us some comfort. That said, we still want to take precautions. Now, the third reason that we don't have to worry very much about coming back home after the workplace is that we have tens of thousands of first responders, healthcare workers, physicians, nurses, laboratory workers who have been coming home every day, and including all of those who are out there working as essential people in our community. And they take no special precautions other than common sense when coming home. It's not necessary to use a special laundry soap. It is not necessary to change clothes. It is not necessary to do anything except clean your hands and dispose of a disposable mask or wash a washable mask. And the last thing that is even more important than all of this is, as we gradually reopen our community, I will be wearing a mask, and so will be the persons that I'm talking to. So the opportunity of spreading virus from person to person will be drastically reduced. So again, no special precautions are necessary as we return to the workforce. Common sense, wash hands, keep your hands out of your face. Now, yes.
And the other question was, if you have somebody in your household who might be sick, how do you take care of them and also keep everybody else protected in the household?
Very good. So the categories are quarantine, which means we just don't go out of the house and we're not sick. But then there's isolation, and that's a completely different topic. And that's what we'll talk about right now. If an individual is sick or has been diagnosed or has been suspected of having the COVID-19 virus and is told to stay home and self-isolate, there's three categories. There's the sick person, there's a household member, and then on a rare occasion, there's a caregiver. And in some households, because the sick person may have a mental or physical disability and need care, we have to address all three of those differently. So the household member who is in the house with the sick person, it's really quite simple. Try to not be in the same room ever. Now, if that's not possible, both the patient and the household member should wear a mask. All high touch areas, and these are common sense, high touch areas are doorknobs, faucets, toilets, maybe countertops if in a particular house they're all touching the same countertop. Those are all hard, non-porous surfaces, easily disinfected with any type of an EPA approved disinfectant, anything that you can buy or can get. And if the stores are completely sold out of that, a 1 to 10 dilution of household bleach. So 1 ounce of household bleach and 10 ounces of water, of tap water, is just fine. I caution you because it is chlorine bleach and it will discolor fabrics, but it won't do anything to faucets or doorknobs. And other than that, common sense. Wash your hands frequently, keep your hands away from your face, and disinfect the non-porous surfaces. On those rare occasions where someone is living with an individual who of advanced age who needs physical care, and that person of advanced age is sick, or the person who needs help is sick, all one can do is try to recreate what we do in the hospital. PPE is personal protective equipment. That means if I'm caring for someone, I need to protect myself. So the PPE is for the caregiver. Gloves, face mask, head covering, and then some type of a gown if one can get it. And if you can't get a gown, just wear the same overgown daily and wash it in regular laundry. No special laundry is necessary. And if it becomes not possible to care for that person, then the person needs to be in a facility where he or she can be taken care of. So the three categories at home are the patient, a household member who is not providing direct care, and on the rare occasion, a household member who has to provide care. Each is treated differently. So I'll stop so I don't take up too much time, but I will be available for the rest of the conference.
I always like to give the opportunity for any of our guest speakers if they have any questions for any of the other panelists. So do any of you have any questions for other panelists? And as you think that one through, I'm going to go to Steve also. And Steve has some questions that'll be for us.
Sure. The first question, Mayor, is how do we make sure that we are prepared for the next pandemic at the state level? How can we shore up our public health infrastructure for years to come?
I think the Assemblywoman probably should take this one first.
Yeah, that's a great question. And I think, obviously this has led to a lot of learning at the state level and at the local level and at the county level. And I think we're just getting out of the mode in Sacramento where we're really focused on how do we get through this crisis, ensure there's no surge, make sure everyone's safe. The next step of what we're looking at, we started budget hearings just yesterday, focused really on the state budget. As you heard from the city, our city budgets are taking a hit, our county budgets are taking a hit, our state budget is going to take a hit. How do we maintain our reserves, do the fiscally responsible thing, but also help California recover? So that's our next step, is really looking at recovery and making sure California comes out of this smoothly and we're able to support Californians so that they have a job, they are able to maintain their homes, and they have a quality life. And then the question is, how do we learn from this? I think we saw a lot of things, masks that were in storage that were expired. Let's not let that happen again. And make sure that we continue. I mean, one of the things that California has been really benefiting from is our reserves. I mean, thank you, Governor Brown, for making sure that we were in a position where we had a lot of fiscal reserves for a moment like this. And so continuing that learning to make sure that moving forward, if this were to happen again, we would be in the same position to support the needs of California, to buy the PPE that we needed, to work to support our homeless in the way that they were needed to be supported. And all of that is coming out of our reserves right now. So I think it really is looking at what we could have done better. And there was a lot of things that I think we could have done better, making sure we take a hard look at those. And what did we do right? And how do we continue to do those things? But first, we're focused on the here and now, then we're focused on the recovery, and then we'll be really focused on learning from what happened.
Great.
All right, next question. How is COVID-19 impacting the census in Contra Costa County?
Well, Candace.
Yes, well, and surprisingly, we've been getting much higher participation than a lot of counties throughout the state. However, that's not to say that we're in the clear. So we continue to push very, very hard to make sure that we are getting a complete count. And so in fact, Monday at noon, I'm going to be on another census committee meeting, and we're now drilling down to who hasn't been counted yet. And so hopefully all of you on this call, when you got your first letter, you went right online and filled out your census.
Yep.
If you didn't, you probably got a follow-up letter, and then you're going to start getting phone calls. And so luckily, we're not letting this COVID-19 crisis stop us. Where it is making it a little more challenging and where we will likely see extensions of time to collect the data is doing the door-to-door and trying to do that, because right now in this current situation, we're trying to avoid putting people in that situation. But fortunately, our early efforts, which I really give kudos to my fellow supervisor, Diane Burgess, who's the chair of our census committee. I'm the co-chair. I mean, we just all guns blazing. And in South County, my representative has been Aparna Reddy, one of our great San Ramon residents. Aparna, since day one last summer, just was out there highlighting it. So I'm just going to guess that San Ramon probably has one of the highest levels of participation, simply because it's been out there so much. And we're really working still with our hard to count communities, those who might not be familiar with the census, those who might have a language barrier, but we're not letting up on the census.
All right, next question, and we get this a lot from residents just about how they can help, but specifically, what can residents do to support local healthcare providers and healthcare workers right now?
Rick, one of the common questions I hear is, can they bring food? Can they bring supplies? Your thoughts and recommendations.
Yeah, I appreciate that. I'll echo every medical professional in the region. The first thing is continue to comply with the requirements and the directives that have been put in place. That's number one. But related to those other two questions, Mayor, so food, every healthcare system is handling this a little bit differently. At Stanford, we've actually tried to be really conscientious about restricting what actually enters our hospital environment. And so while there are many well-intentioned people that would love to donate food directly, we're trying to manage that. And so one of the ways that we've figured out how to sort of circumvent that infection control issue is we have a foundation, just like many other healthcare organizations, that residents can donate to and can prescribe that they would like that money used for frontline healthcare support in the form of meals or otherwise. And then what we are able to do is work with selected vendors that have established infection control procedures that we can trace and monitor, and then we can support our staff that way. So those are the ways that I would suggest financially. From a donation standpoint around PPE, like I say, every place is doing it a little bit differently. Some organizations are accepting homemade PPE, and I think that's obviously been endorsed by a number of the regulatory agencies. So that's not out of the question. So make sure you do your homework on what the healthcare organization that you'd like to donate that to has outlined in terms of the processes. And again, here at Stanford Health Care, our protocol is any PPE that is in its original packaging, it could be expired, but what we have is a supply chain task force that assesses all of that PPE before we put it into circulation to make sure that it's got the integrity that it needs. So again, those would be my recommendations for people that would like to have immediate donations and impact. And then the last thing I would say, I know it sounds like a little thing or trivial or otherwise, but the posters that people drop off at the front of the hospital, the postings on social media, the recognition of the people that are actually doing this work, that goes a tremendously long way. People see that when they come to work every day, and it's sometimes the boost that they need to just keep going. So any ways that you can find to recognize the people that are doing this work is also very appreciated.
Thank you, sir.
All right, the next question, I'll try to summarize several questions into one topic because they all relate. There are people that have mentioned that they had a really bad flu back in December, January, or February, and they feel that they may have been already exposed and fought it off. And the question surrounds the availability of an antibody test and when that's going to be scaled. And also, will the antibody test be able to determine if they've been exposed and are they safe now, essentially immune to go out?
I'll look to Dr. Joseph and then Rick after that to respond. Are you comfortable, Dr. Joseph, with that responding to that?
Yes, yeah, very much so. This is what I deal with every day. And Mr. Shumway was very clear in mentioning there's two different tests. There's the test to diagnose the disease, and that's using the cotton swab inserting it in the nose and doing a very special molecular test. Two things about that. If it's positive, that's just satisfactory to make a diagnosis. But now with all of the drive-through clinics that are available, many people are just being tested because they choose to do so. And a negative test should not give a false sense of wellness. A negative test implies that you're not infected at that time, but an individual with a negative test could get infected tomorrow. So it doesn't imply any longevity of not being infected. The answer to the question, though, is not the test that goes through the nose, but a blood test for antibody. And this test will be available. It's now available, as Mr. Shumway mentioned, to physicians of the Stanford Health Care network, but it will be available to all clinicians within a week or two. Abbott has a test that was submitted Wednesday and should be approved rapidly by the FDA. There are already 3 approved tests for antibody. Antibody tells us if we have been previously infected. So if I would test anybody here that we're talking to today for measles, everyone's going to be positive. And the antibody test for the coronavirus will be positive if a person had a coronavirus infection in December, January, February, or even last week. So the answer to the question, the test should be available within a week or two, widely available. It's a blood test, usually a finger stick, but it may be blood drawn from the middle of the arm, and it will tell anyone if they've had the infection.
The really important follow-up question is, are you then immune from catching it a second time? Do we know yet?
Really important. So the antibodies that we are measuring, we don't know if they are neutralizing antibodies or protective antibodies like we do for measles. That said, we are looking very, very hard for anyone who has had a proven second infection. So of all of the tens of thousands of people who have had this infection, we have not yet identified anyone who recovered, turned negative, and then got re-exposed at a second infection. That's different from relapse. A relapse can occur, but a relapse will occur within a couple of weeks. But I'm talking about a person who was infected, proven cured, back to work, and then got reinfected. And so far, since we haven't seen that, we're hoping that this antibody test confers immunity.
And as a kind of a follow-up, can you talk about that as the population becomes, as people who have had it and no longer can have it again, and this herd, the ability of the herd to have immunity, talk about what that means and the importance of how an infection works through a group and eventually can burn itself out.
Well, herd immunity means, it actually is a farming term. I think more politically correct now, we're calling it community immunity. But herd immunity means that 80% or greater are immune. That means that although there still are some people that are susceptible, they are so few that an epidemic will not occur. Okay. If one does get infected and all of the persons they come in contact, 8 out of 10 can't get it, it will burn itself out. That's true for a lot of diseases, and that is where we start to eradicate a disease, such as smallpox. So there hasn't been a case of smallpox since 1977 because of herd immunity. What is unknown about this virus is, will it be like influenza, meaning that the immunity status is short-lived, or will it be permanent? And the second question is, will the virus mutate so that the immunity that we have now does not represent a mutated virus in the future? All unanswered questions, all extremely important, and I promise you being studied very extensively.
Thank you, sir.
All right, the next question is, how will COVID-19 impact the November 2020 election and voting process in California?
Well, and I would love to just mention that we did send a letter to the governor. Board of Supervisors voted on it to request an all-male election. We simply do not want to put at risk poll workers. We don't want to put at risk the general public. And so from Contra Costa standpoint, we are strongly advocating having an all-male election. We feel that the cost savings that we'll save from having to hire poll workers at certain sites can be offset by the additional cost of postage. We will still have available at City Hall, people able to go and deposit their ballot in secure places. And we will still have some sites where you can actually go in and actually vote if you really feel strongly that you don't want to. But we feel it's very, very important to not disenfranchise anyone this year out of a fear of the COVID-19.
Assemblymember.
Yeah, I'll add to that. I think that we very much agree with the supervisor in the county. We've seen some elections happen since COVID-19 and it hasn't gone well. And, there are definitely people in the medical profession who believe we could have a resurgence or have cases happening in the fall. So we can't count on being out of this come election day. And so we have introduced a bill, we've amended a bill that was sitting in the Senate to mandate that all counties provide full mail-in ballots, and that bill will start moving on May 4th. And we anticipate it should get supported. Mark Berman is leading the way as our elections chair, and I'm co-authoring that, but I think it is very much the opinion of the state that people should have the right to vote. And that right now that means delivering their ballots to their homes and making it accessible. So we are looking at a all state mail-in process.
Thank you.
All right. The next one is, could you please discuss the effectiveness of homemade cloth masks versus disposable masks?
I think last week, Dr. Joseph talked about this, but it sounds like it should be a good follow-on and a refresher.
Sure. Following the guidelines that are widely available on the internet, the cloth masks are good. What is not good is a single layer of t-shirt cotton. What is good is 4 layers of cotton or quilting cotton, or even a mask that's made with a pocket so that one can put a filter in it. And some of the acceptable filters for homemade pocket masks would be vacuum cleaner bags, coffee filters, if there's 3 or 4 layers of those. They all work great and they've been studied extensively. So simple layer of t-shirt cotton won't do the trick. Virus goes right through it. 4 layers of cotton, particularly tightly woven cotton like 600 thread count sheets or quilter's cotton, is fantastic and encouraged. And washing them, simple laundry soap or simple dish soap is just fine.
You talked about a test last week where if you can put it up to a light and not see through it, it was sufficiently thick.
That's correct. It's the bright light test that has been used in developing countries for masks. And if you hold it up to the sun and you can't see through it, or you put it over your eyes and you can't see through it, that's an effective mask.
Thank you.
All right, next question is, what is the city doing to stop the people who continually violate the social distancing rules and ignore warnings?
Joe, our city manager.
Well, that's obviously challenging. The main point is that this has to be a voluntary. Everybody's got to work together, and so we have a city of 80,000, and voluntary compliance with these orders are the most important. So the first step is we take a position of educating folks, and sometimes they know and are trying to get away with it, and sometimes they truly just aren't as deeply involved and informed as one might think. So our first initial interaction would be to continue to educate them and encourage them to abide by the order. Then as we call it, the frequent flyers and those that continually violate the order, then we would up our response. The police department would potentially issue a citation or something of that nature. But a lot of folks see some of these violations, but when you look at it in terms of the entire city, they're not as prevalent as one might think. So when we find those spots, the areas, sometimes it's the parks, sometimes it's area where lots of people want to go, especially in the summertime when the weather's nice. I'm sure that there's going to be some more questions about supermarkets and things like that. And as this new, as I'm hearing Supervisor Andersen say that it's likely that there'll be a mask requirement versus a recommendation. We'll address that as it comes, but our primary focus and strategy will continue to be that we all need to work together to address this and then look for the problem spots and handle them individually.
I know that anecdotally, I spend a lot of time walking around my neighborhood and the areas around where I live, and I have seen people go out of their way to abide by all the rules. We walk in the street around each other. Everybody has been very courteous. In fact, I've never seen so many friendly, in many ways happy people. Maybe they're happy because they're outside for a while, but everybody's waving, and especially we wave at our Fed Express drivers. We're waving at our sanitation workers. We're waving at our mailmen as they go by. We're so appreciative of them spending time with us. But I had a follow-up question about this new rule about mask in place, and I'd like both Candace and Dr. Joseph to comment. This new rule about wearing a mask, does it apply to people who are walking on trails or walking around the city by themselves? And Candace, is that going to apply to people walking?
Now, haven't seen the order yet, but my understanding is no, it will not. It's only going to apply when you're in a position that you're going to come in contact with someone. And so it's not, you have to be masked everywhere. It's masked when you're going to be out and potentially in contact with someone. It's common sense.
Dr. Joseph, you commented about masks and being outdoors and how contagious it might be. Would it be good for a refresher on that?
Yes. The way I have heard this rule come down, I think is very well worded. And it's exactly what was said. If one leaves your house and you go into a building where other persons are present, you have to have a mask on. That's the bottom line. Outdoors, with the airflow, the risk of infection is extremely low unless someone coughs or sneezes directly on you. So outdoors is very protective, and I would defer that to a person's preference. If there is no ordinance requiring a mask when you're walking outside, I would defer to one's preference. In a building, such as all of us are, the air is stagnant. And that's when a mask becomes so important. So as I've heard the rules coming down from New York and Detroit, it is when you leave your home and go into a building where other persons are present, you have to have on a mask.
Great, thank you.
Well, and Bill, I'm just going to add, I had an experience this weekend. My husband and my daughter, who's sheltering in place with us, we did go on a little bit of a hike in the area. And so we all brought our masks with us. When we weren't near someone, we just had the masks down. And as we came closer to people who were going by us, we just, as a courtesy, put them over us so that they would feel safe. We would as well. So I think it's a courtesy thing, even though it's going to be in order.
Great, thank you. Steve, we're about almost 10 minutes after. If you have a question or two to tie up our meeting.
Sure, and many of the questions have been answered. A lot of them were surrounding the masks use, and I think the new order is going to address that. So we took care of several of them, but I do have a good one that might be good for closing with. Being at home so much is taking a mental and emotional toll on many people. What are some coping strategies?
I just want to point out that Senator Steve Glazer did an incredible town hall on this. That I know is on his website with a psychologist who talked about really effective coping mechanisms. So this is something you're thinking about. I would go to the senator's website, which is linked on the San Ramon website, to listen to that because it was really helpful.
And I'm going to add call 211. I mean, if you're feeling at all, like not only if you want to talk to somebody, because there are counselors there, but they also have a lot of different resources. And there are people in need who need a phone call. And so in some of our Wamarinda communities where they have senior programs, they have volunteers who are just calling up seniors to check in on them, to just have a little visit. So call 211, either offering to volunteer, and they might be able to link you up with something. Or in fact, if you just want to talk through issues, they have people there. 211 is a great resource right now.
Thank you. All right. Thank you to all my guests. Next week, one of the subjects we are trying to address is our chain of supply. And we'd like to have somebody come in who can talk to us about making sure that from food and other things that are still being supplied to our stores and how that chain is looking. I want to thank Dr. Joseph for being here again. Thank you, sir. Rick Shumway, Stanford, doing a great job. Thank you, sir. Candace, as always, I appreciate you being here every week. Your updates are really, really informative. Assemblymember, thank you. You had a rich information, data-driven talk. Thank you so much for your information. Joe, as always, thank you for taking care of our city. You're doing a great job, and thank you. And of course, our quarterback, Steve, thank you for questions together. So you guys stay safe, have a wonderful weekend, and have a good week.